Hey everybody, welcome back to the answer session of this week's Ask Dr. Dan. Again, this week we were talking about the VFR, which stands for fractionated radiofrequency. This is newly FDA cleared. It is used for many different things on the face and body, such as skin tightening, wrinkle reduction, acne scars, pigmented lesions such as sunspots, stretch marks, other scars on the body. So it's used for a multitude of things. So with that, let's get to the questions. So the first question is, how does this device work? Very simply, this is a little invasive, so you do have to have a special handpiece that's used for each person. So this is the cap. We remove that cap, and then for each person, we would put on a tip. We put the tip on, okay, and then depending on what area we're doing, so if we're doing the full face, you basically put it in the area that you want to treat, and when you push this trigger, it releases those pins, and then once those pins are released, the radio frequency goes into the tissue to cause the damage that's needed for the healing. Then we go right underneath to the next level, and we basically just keep going down and then to the side, and we just keep going, and then we make sure that we get the whole area that's being treated. Each area that you treat, you only go over it once, and then you put a little cream on afterwards just to protect the skin, and then you're done. So the next question is, how long is the recovery? So the recovery is variable depending on a couple of things. So one, depending on how strong and how superficial or deep you are using this device, because you can control the depth to get right on the epidermis or deeper into the dermis. And you can also do it for something that's called ablation or coagulation, where ablation is more superficial and it's more of a resurfacing, where the coagulation is a little bit deeper and more of a remodeling. So the ablation is a little bit more aggressive treatment, and it does require a little bit more recovery. So sometimes even up to like 2 weeks, where something like the coagulation is only a couple of days. Now, for a lot of these, what we do is we do a little mix of ablation and coagulation, which is more just like 5 to 7 days. Now, when we say recovery, it's not that you can't go out, it's just that you have to keep the skin very protected. You have to be very careful with the sun. So, the longer you have to do that for, the more aggressive the treatment. It varies. It also depends. So the body is also going to recover much slower than the face, because our face is much more vascular and heals much faster. So for something that might only take a week in the face, it might take 2 or 3 weeks on the chest area or anywhere else in the body. So depending on where and how aggressive we get is how the recovery is. So question number 3, how many treatments? So again, that varies. The more aggressive you get, the less treatments typically you'll need. So if you get very aggressive, you might be able to do it in only 1 or 2 treatments. What we do most people with that mix of ablation and coagulation, usually somewhere between 3 to 6 treatments. What we do is we separate those treatments by 6 weeks apart. That way we give the skin a chance to heal, and then we go on with the next one. So again, it depends on how aggressive you get and which body area you are doing. So number 4, who can't have this done? So there are some people that cannot have this procedure done. People such as uncontrolled diabetics, people that have any infection in the area to be treated, certain rheumatologic conditions like lupus or rheumatoid arthritis, you have to be very careful. Also, if there's any tanning that was recent, if there's any tanning on the skin, you have to be very careful, because what can happen is after the treatment, you can get hyperpigmentation in that area, and it may take months to years to fully go away, if it fully goes away. Also, if people have a history of what they call keloiding, which is the scar overgrowth, you don't want to do that, because you run the risk of causing keloids in the area that you're treating. Other than that, what we will typically do is we'll do a test area and somewhere that's not very visible, usually in the sideburn area if we're doing the face, and then we have them patients come back in a couple days or a week, and we see how it looks. If it looks good, then we'll proceed with doing the rest of the face or wherever else we're doing, and we'll go from there. But other than that, as long as you don't have any of those conditions, you can have this procedure done. Question number 4 is, how much does it hurt? So again, this is a little bit more aggressive procedure than the other things we've talked about, which are just on the surface. This is injecting some pins into the area. So there is some pain involved with this. However, what we do is we use a topical anesthetic. We let that sit for about 30 minutes, and then we do the treatment. And with that, it's very, very well tolerated. There's very minimal pain. The other thing that we really like about the VFR as it compared to anything similar is that Viora actually works very hard at making their treatments comfortable. So there's two things that it does. On the top and the bottom here, there are vacuums, and so what that does is it sucks the tissue up. So it makes sure, one thing, that the tissue is nice and flush so that when you're putting those pins in, it has a good surface area. But the other thing it does is the vacuum actually disguises the pain, so it's tricking your body so that you're not feeling the pain. The other thing is these little bars here and here, they're cooling, so it brings a nice cooling to the area on the surface of the skin, so you don't feel that pain with the heat. So they really worked hard to make this as comfortable as possible, and that mixed with the topical anesthetic really makes this a pretty comfortable procedure to have done. And last question, so how is this different than microneedling? So it's very similar, but it is a little bit different. So with microneedling, you're just using those little needles, and basically that's just causing mechanical damage. Where this, you're getting that plus the radio frequency that's being shot through. Also, you can control the depth of the radio frequency as well, so you can do it, again, very superficially or very deep. So it's similar to microneedling, but it's a much better procedure than just plain microneedling. So that's it for this week. I hope you all have a great Thanksgiving. Remember to follow us on our social media at Facebook at Apex Center for Regenerative Medicine, on Instagram at RegenerateNJ, and subscribe to our YouTube page at Apex Center for Regenerative Medicine. So again, have a great holiday, and remember, don't operate, regenerate.